Hi, I'm Susie Bayley. I am the Head of Communications for Derby and Derbyshire LMC.
Okay, and you were asking the GPC exec this morning at conference about the GP forward view. Tell me a little bit about what you asked.
Yes, so my question to the GP exec was the fact that it's 12 months since the inception of the GP forward view. Well, I feel it's spectacularly failed, and that although we're trying to hold local CCGs to account, and they're trying to hold NHS England to account, that we need a time period, a certain amount of months hence, when we actually turn around and say to the electorate that they've been misled on the investment for general practice, and actually we need to be honest to the public about that.
Okay, and what response did you get from the executive?
So there was a reiteration of the figures involved in the investment and what has been put into the GP forward view so far, but there was not a clear answer to the question on the timescales in which we need to turn around and say enough is enough.
What would you like GPC executive to say in response to that?
I would like to have a clear threshold, say if in the next 6 months we have not seen a clear investment in general practice that has gone direct to general practice and not to schemes and management consultants. If we haven't achieved that, at that point we will publicise widely the fact that that money is not coming to GPs and that the funding promised is inaccurate and misleading.
And then at that point, do you think, what do you think GP should be doing going forward from that?
I think we need to be informing our patients, we need to be engaging our patient participation groups and informing them that the reason that they can't get the GP service they want and deserve is government failings.
Do you think GPC has done enough to ensure that the funding is being delivered?
I think they are working with NHS England to hold account. It's very difficult because some money's going to CCGs. There's lots of hoop jumping that needs to be done, and it's a bit of a postcode lottery as to where money's gone. But obviously, money is not going into general practice, so that we can provide the care for patients.